I keep the medicine with me in my safe, in my locked room, because it's just better that way. First thing in the morning, she's waiting for that Suboxone. We give those out quickly, because if not, she'll start to feel cravings, withdrawal symptoms and all that. So I try to be really regular on when she gets that. I'm not an angry person, but I'm like outraged. Like, why should I have to do this in my own house? But then it became like, look, just do what works.
Jean Holbrook is a psychiatric nurse who has been trying to help her 31-year-old daughter, Jennifer, fight an opioid addiction for more than a decade. Jennifer has been through treatment multiple times, but has always relapsed afterward. So for now, living at home is the best option, especially because of her 3-year-old daughter. The Holbrooks live in Massachusetts, where the rate of opioid-related deaths is double the national average. Like in other states, there are dozens of treatment options, but few reliable ways to choose which one is best. Since she started using heroin at 15 years old, Jenny has gone through 12 inpatient treatment programs, spent 2 years on methadone, and most recently went through a detox and behavioral program while in jail.
They gave me an option. They said, you can do your county year, which with good time would mean I would be in jail for 8 months, or there's a program at this other jail, but there's groups all day. There's rules, you have to get up at 5:30 in the morning, you have to go to bed at 9 o'clock at night. If you swear, you have to say check after you swear. It's supposed to be almost like military style run.
My dream would have been that she'd come out of jail and would be just perfectly fine and clean and never have another thought about opiates. But that's not what happened, and I don't think that's probably the reality for many people in this situation.
Most people who want to get help with opioid use disorder don't get advice from their doctors. So when they want to get clean, they're left trying to navigate a complicated and loosely regulated network of possibilities.
So when you look at how the federal government or states regulate this, what they regulate for is not quality of delivery of care, but for the safety of a clinic space. So you have huge variation, and nobody is mandated to report outcomes of how good they're doing.
In the absence of any real structure for finding treatment options, people are left to their own devices to make what can possibly be a life or death decision.
I would say that patients get better because they were lucky, that they walked into a place that happened to have high quality care, that evaluated all of the things that they needed to.
Even working in this, I don't even still know a lot of the different programs. I think a lot of it is Google searches.
The first time I had to go to a detox, my mother kind of did it for me. I could only go to one detox if I had a drug problem, there's a certain one. And she made all these calls to try to get it so that I could go to this other detox.
You have a desperate feeling when you're trying to get help and you're not sure which way to go. And you're not sure if you call the number on the back of your insurance card and they tell you to go to the hospital and maybe somebody at the ER can get an evaluation. And then you're desperate to try to talk her into going.
This is a national dilemma because, no, there are no states that I'm aware of that are doing it right. A structure focused on quality rather than just safety.
Some organizations are stepping in to help solve this problem. Mary Wheeler is a harm reduction worker in Lynn, Massachusetts. Part of her job is helping people decide between options ranging from 12-step abstinence methods to medically assisted treatment.
One of the things we'll usually ask first is, well, what have you tried? Do you have a house? Do you have a job? We ask all these questions to try and make sure we're supporting the person to access a program that fits their needs. I don't think it's a matter of programs not working that people go through so many. I think it's just every person is so different and every person needs something a little bit different. There's a part of me where I see this person who says, this doesn't work for me and this does. And I wish that the system would listen to them. Instead of saying, do A, B, and C, you turn it over and say, what do you think works for you?
And for many, even when they do make a decision, actually getting a spot can be a whole other challenge.
How long does it take when somebody wants treatment? It can be same day or it can be weeks.
Even though it's tough for Jenny and Jean to live together, they both feel treatment at home is the best remaining option after so many others have failed.
She came out of jail, you could kind of say, and that's not really a program, but it is not your regular everyday using. So there really isn't a program in my mind that would do anything. And nothing's perfect, that's for sure. And it causes all kinds of grief in the house.
Part of the disease is that you make everybody around you hate you. That's a symptom of the disease, is people strongly disliking you and putting locks on your doors and all that crap.
If you were here visiting, you might come in and we look okay, but you might not notice that when I went into the bathroom, I took my pocketbook with me.
Right now it's kind of working, but it depends. It really, I'm literally taking it day by day.
I think there's not enough addicts involved coming up with the treatment, because if you want to know something, talk to them. I've learned more from her than I did working and being in school. I'm like, wow, this was a huge education.